Thank you for tuning into another episode of the Middle Hustle Corp podcast. Today on our show, I have Dr. Sentil Gopal, one of my best friends, a longtime friend, and a trustworthy companion. Sentil and I have been through medical school together, and I guess the rest is history. But I think it's more like past, present, and future, if that makes any sense. Sentil always carried some form of uniqueness about him and had legendary status. He's now juggling clinical work and business administration work in Malaysia, and I'd probably let him speak for himself. Anyway, welcome, Sentil, to the Middle Hustle podcast, and thank you for finally taking the time to be on. Anyway, again, let's begin by you introducing yourself to the audience, please.
Awesome. Thank you very much, Shafiq Rahman Abdul Ghafur Shabullah, the man that I know to have the longest name in my entire life. Imagine trying to find his name while boarding a flight that you are late for. The system cuts you into half and takes the worst part of the half.
But we were dealing with daylight problems as well then.
Yeah, we had problems with timing. But yeah, thank you. Thank you for the awesome and very humbling introduction.
It's true.
It's a very humbling introduction. I mean, I wouldn't be here if not for you. I wouldn't be here.
Okay. Thank you.
You've influenced my life in many ways. So I'm glad to be on this podcast and see how we can grow this further.
Thank you. Yes. So Sentil, I remember, we finished med school, and after that we went on our separate ways in internship. I ended up in Sabah, Kota Kinabalu, and you stayed on in West Malaysia in Klang, and then you're doing your stints. Then I remember from my vague memory, you were doing orthopedics.
Yeah.
Then so what happened? Just tell us a little bit about that journey from what you were doing then till what you're doing now.
Oof, that is one heck of a journey. So I did my mandatory service, and then I went to what I call it polyclinic, and then I've always harbored a ambition to do orthopedics because I liked all the cutting and the hammering and the wiring. So got my transfer, but it didn't turn out to what I expected it to be. I felt that as a clinician, if I pursued down this path, I would have regressed as a clinician. So
sorry, you would have been
regressed.
What does that mean?
Regressed.
Okay. I understand.
I wouldn't have been the doctor I am now. In that sense, I mean, it was the first step. So got married, moved to Kuching. Then
Kuching is
then I became
East Malaysia.
Yep. Then I started as a registrar in an A&E department in a private hospital. But even at that time, I was already struggling in terms of empathizing towards the patient. I felt that seeing a patient was a chore, listening to them was a chore, and it felt tedious. I felt that seeing patients was tedious. My career was stagnated, and that's when my dear brother Shafiq here gave me a second chance. At that time, Shafiq, you were in Singapore. You just got married as well.
I was.
Yes. You just got married as well. And then you had your ambitions of finishing your cardiothoracic surgery. And you started to chase that part. Seriously.
Yes.
You moved to New Zealand, and then suddenly there was a pathway for me to grow. I mean, looking back right now, if you ask me after going to be 10 years now since gone to New Zealand, I mean, we are at 10. It's been 6 years since I left New Zealand. 5 years.
Yeah, wow.
5 years since I left New Zealand, correct. So looking back then, I think I was looking for an escape in the sense that I wanted to try something new and see whether the environment was different. So my wife supported me through this phase. So Yeah. So we packed up our life in Malaysia in 3 months and
Mm.
moved with a 5-month-old baby to
Yeah.
New Zealand.
Yeah.
That was that was something. I mean, looking back, it's like
Abs-
we had to navigate weather before I even reached New Zealand. Then reached New Zealand's,
Earthquakes in New Zealand,
yeah,
isn't
New
it?
Zealand, because there was an
Yeah.
earthquake in Wellington that time, and they closed the port and the city,
Correct.
so there
Yeah.
was no processing going on.
Mm.
So yeah, moved a container full of
Yeah.
household belongings to New Plymouth and moved with the 5 month
Yeah.
old infant.
Yes. Yes.
Yeah.
Yes.
Looking back, it's
I
like,
remember visiting you
yeah,
at your place and I was astonished the number of boxes you had in your garage.
correct. Yeah.
Yeah.
And then settle into the routine of the job there. Then I realized that it's not the environment, it was me that was the problem. That's when in New Zealand I realized that no matter where I go, if I don't change my attitude and perception to treating patients, it'll be the same. I could go to US or UK or even Australia for that matter, I'll be still the same schmuck. So that's when I started to listen to patients. And I started to listen to patients. I started to build a bit of compassion, empathy, and understanding. And I would say that's when my profession and interest in what I was doing took off. It would have been a dingy GP clinic which was undergoing renovation and had no roof and
Yeah.
no wall.
Yeah.
But
Where was
during that
this?
time, that's when I realized in New Plymouth.
In New Plymouth. Yeah, I remember
New
that.
Plymouth,
Yes,
yeah.
yes.
No
I mean,
roof
that
and
would
no
have been,
wall.
I
Yeah.
mean, what was your thinking process? You coming back? I mean, you said, you felt, you kind of found yourself, but what was the thinking process for you returning back to Malaysia from New Zealand?
It was twofold. I mean, I was torn in the sense that, I knew that if I stayed on New Zealand, my path would have been different.
Yeah.
I would have gone into, I mean, I was in training, I was on the path for GP and urgent
Yeah.
care. But
Hmm.
another part was, would I have ventured into business?
Hmm.
Hard to tell. Because once you go down to that part, it's hard to tell. But I was already
Yeah.
being exposed to administrative work as well.
Hmm.
So then when mom passed away and
Hmm.
dad said he was not going to come,
Yeah.
so then the decision was easy for me. Okay, it's
Yeah.
time to go back home.
Yeah.
But
Yeah.
going back home, easy decision, but it took a toll on my wife, on Lavanya.
Yes. Yeah.
Because moving, starting all over again, it took a toll.
Hmm.
And then we came back within 4 months, COVID hit.
Hmm. Yeah.
Yeah, COVID hit. And there we were trying to rebuild of our lives in Malaysia, in West Malaysia,
Yeah.
where Lavanya had not worked at all her entire medical career
Hmm.
in the middle of a pandemic.
Yeah.
With a 4-year-old
Yeah.
toddler.
Yeah. It's definitely a trying time that time for you.
Yeah.
Yeah.
But then, I mean, everything happens for a reason.
Yes.
I got the job offer to be a resident doctor in a international airport. Not many people can say that.
Yeah. Oh, that's
Not many
amazing.
people can say that. Yep. And then it just went from there. I mean, I grew. I grew as a person. I grew as a husband. I grew as a father. I grew as a son.
Yeah.
I would say in the past 5 years.
Yeah. Yeah, absolutely. I mean, like I said, everything happens for a reason, isn't it? And if one door closes, another door opens, and you have to you have to just go down that path and see where it leads you.
Yeah.
And plus, as well, age is a factor. family dynamics change, priorities change, and we sort of have to, like you said, you have to juggle a
Roles.
few things.
You
You
have to
can't
have
think,
roles. Yeah.
yeah, a few roles, and you can't think about yourself anymore.
No, it's
Yeah,
like in one day you can be a boss,
yeah,
you can be an employee, you
mm,
can be a doctor,
mm,
father,
yeah,
son-in-law, brother-in-law, wife,
yeah,
sorry, husband,
yeah. Many hats.
husband, and many hats on in one moment. Yeah.
Yeah. So I know what you're doing right now, Sentil, but I just want to. It's very interesting what you're doing right now. But just for the listeners, what are you doing right now? You're doing a little bit of business administration plus a bit of clinical work, isn't it?
Yeah.
Yeah. So do you want to
So
expand on that?
my role that I started off with, I was probably a clinician, but
Yeah.
when the moment came during pandemic, the role changed. So reshuffling, redundancy. I mean, I'm thankful and grateful that uh, I wasn't retrenched during the
Yeah.
pandemic. But easily
Yeah.
could have happened,
Mm.
and that would have been a challenge. But I was not. But I was given an opportunity to be the doctor in charge of the KLI 2 terminal.
Mm.
And during the height of the pandemic, that means from 2020 to 2022, by the time Malaysia exited the pandemic, I was in charge of the in-house clinic. I was running 4 COVID screening centers across both terminals, in charge of the mega vaccination center where we vaccinated 22,000 Malaysian airport staff and vendors.
Yeah, that's yeah.
And looking back, I realized that I don't know how I did it, but somehow I knew I could do it. I don't know if that makes sense. Despite the challenges of working and collaborating, I learned the
Yeah.
importance of collaboration.
Yeah.
There was no one-man army or one-man show.
Yeah.
That's when I mean, I was always an island back
Yeah.
in medical school.
Yeah.
But then I realized that to be a leader, I had to surround myself with people that were actually better than me, smarter than me, more intelligent than me. But my job was to give the vision, make them believe in themselves, and then get them to do the task in hand. That's when I realized, okay, I think I found my calling.
Okay.
Yeah.
Okay. That's
As a clinician, I reached my peak in sense that I could empathize with the patient. They could relate to me and talk to me as their friend rather than a patient. Yeah. And realized that, okay, I could actually, I could actually within 2 minutes build a rapport and make them comfortable, and then they open up. That's what we want. End of the day, our job is like, we have like less than 1 minute to make an impression with a total stranger.
Correct.
And then make them trust you with their life. It's something sacred that nobody sees, that bond that, it's like you're a total stranger to me, I'm a total stranger to you. The only reason why you are here is because you need something. You need to be taken care of. And health is one thing that, we do take things for granted with it from time to time, but it's something sacred that you give.
Yes.
I'm giving my health to you to take care.
Yeah.
And it's unconditional trust.
Yes, correct. The trust.
Yeah.
Yeah.
The trust, unconditional trust. Like nowadays with the newer generation workforce, it's become very arbitrary in the sense that if I see this one patient, it's like, okay, this one patient, that means I'm getting extra $5 for seeing that patient. If I do a procedure, I get extra X amount. It's not very arbitrary. That bond is no longer there. But that's what people want when they see their doctor.
Yeah.
A bond that exists between one person who's giving you that trust and another person who has to respect that trust and do their best.
Yeah. Yeah, absolutely. You said it really nicely, Sentil. That's now. So you're doing that, and I remember again you're doing some administration role as well. You're trying to
Yep.
do some integration.
So so as my during the pandemic, as my role evolved, so I had to take on a few hats as well.
Yeah.
Besides being a doctor, so I had to become an administrator.
Mm.
That means I had to run operations, which mean taking care of human resource, finance, medication, inventory,
Mm.
facilities in a small group.
Yeah.
In a small group, in the sense that, again, wearing many hats at
Yeah.
the same time. It was challenging. I mean, I felt overwhelmed
Yeah.
because there was no support from higher management. They were of the kin of figure it out as you go.
Yeah. Yeah.
So figure it out as you go.
Yeah.
So I figured it out as I went, and I
Mm.
realized that again, teamwork is very important.
Yes. Yes.
Yeah.
You got to be a team player.
Team players.
Yeah.
Figuring out as I went, but it was a good learning experience in the sense that I realized that okay, I can actually build a team,
Yeah.
run a team, and also motivate the team to do better.
Mm. Mm.
Motivate the team to do better in a sense that it's come to a stage where I'm proud to say that when I took over the place that I was working, morale was low. In a sense that the doctors in charge were not taking any accountability or responsibility for the service that they were providing.
Mm.
So staff felt detached.
Okay.
Detached, and they're just showing up to work for the sake of showing up.
Yeah. Yeah. Yeah.
So in 4 years, my retention rate on average is 2.5 years.
Yeah.
Which is quite high for Malaysian staff in the
Yeah.
medical setting.
Yeah.
My oldest staff is 10 years in service.
Wow.
10 years in service. Next is 8 years.
Yeah. Yeah.
And my next cohort batch, they're currently 2.5 years in their service.
Okay. Interesting. That's really good, Sentil.
2.5 years.
Yeah.
And we have the highest rating in the group, 4.7 with 310 reviews.
Wow. That's great.
4.7, 310 reviews.
Yeah.
And we also have the highest warning letters.
Oh, is it? What does that mean?
Yeah. Warning letters in the sense that sentinel mistakes that have happened that I have deemed that you need a warning letter, but they still stay.
Oh, right. Okay. Interesting.
They still stay. So there was during the recent merger and acquisition, the incoming group HR said that your clinic has the highest reviews, but also the highest number of warning letters.
Okay.
But also the highest retention rate.
Okay.
In average compared to the rest of the clinics in the group. So I said, I am open, but I am firm. If you make a mistake, you take responsibility for it.
Yeah, absolutely. Yeah, which kind of just segues into my next question. What sort of challenges do you sort of face in your role or at work?
In the role, because of the location that I'm working in, is we have to collaborate with multiple stakeholders.
Yeah.
In the sense that there's the airport authorities, there's the ministry authorities, then the vendors that are working in the airport. So each one has a unique operational demand, unique requirements that we have to tailor to their requests.
Yes.
Because the airport never sleeps. So operations never sleep.
Yeah. Malaysia is it's a busy airport. KL, KLIA, KLIA 2. Yeah.
2. So it was tailoring and individualizing those needs that they requested.
Yes.
Whether it's doing a swab at 4 a.m.
Yeah.
Yeah. Random urine drug test at 2 a.m.
Mm. Mm. Yeah.
So unique. That means it's like you have to be prepared to do things that no
Yeah.
one else would do,
Yeah.
seize the
Yeah.
opportunity,
Yeah.
and also build up relationships
Yeah. So
within the stakeholders.
and how do you go about overcoming those challenges? Like it's just meetings
I
or like
think
getting
end of the
together
day
or
is not really end of the day. It's what I realized that it came down to communication.
yeah.
Communication, how you communicate with different people from different backgrounds, and especially in our setting, one of the biggest challenges I think we all face is the generational gap. How
Mm.
to talk to boomers, Gen
Mm.
X, millennials, and Gen Zs. Each one requires a very specific approach to talk to and to get the job done. So that was the I think the biggest challenge that I faced, and also the biggest challenge that I had to overcome by
Mm.
just reading, talking, seeing the response, and
Yeah.
yeah, and just getting feedback.
Yeah.
Another thing that I learned over the past 2 years was the importance of feedback.
Yeah. Yeah.
Because as a lead, yeah,
And you action those feedbacks.
yes, action. I mean, it again also it's like I had to rewire myself. Because when it comes to feedback, everyone has this perception that, oh, feedback is negative.
Mm.
That means it's like, oh, if I'm giving feedback, I'm going to receive feedback, all feedback is negative. That's when I told myself first that feedback is feedback. Whether you want to label it as good feedback or bad feedback is on your head, on your
Correct.
perception.
Yes.
Yeah.
Yes. Yeah.
And that's what I even tell my staff as well. Feedback is feedback. It
Mm.
depends how you want to take it.
Yes. Yeah. Absolutely. Now, like like I said in the beginning, you have lots of hats. You know, being a father is another hat as well, and you sort of running, being an airport physician and being a father, being a husband, and with how society is going right now, everything is expensive. Cost of living is expensive. You probably have overhead expenses as well. Like how how you how you getting by? Like what are you doing to manage all this what do you put this expenses?
Expenses. Okay.
Earn
I
more.
mean, I wouldn't say it's earn more. I mean, earn more is
Yeah.
always there. It's like
Yeah.
you have to earn more because, as your OPEX increases, you have to generate more revenue.
Yeah. Yes. What
But
OPEX as in what's OPEX?
operating
Oh yeah,
expenditures.
sorry. You gotta
Sorry, man.
you gotta be, yeah. Not many people understand the lingo, Sentil.
Yeah. No, I mean, I have to lah because the past 3 years it's all CAPEX, OPEX,
Okay.
follow through costs, absorb costs, yeah, all
Yeah.
that. But yeah, I mean, what else? I mean, one thing I'm grateful for is the job. You get a decent salary in the
Yeah.
job.
Yeah.
Yep. And then the wife Lavanya is also working.
Yes.
So it's a good, decent combined salary between the two
Yeah.
of us to
Yeah.
live a roughly comfortable life.
Yes.
But end of the day, it's about managing your expectations and your lifestyle.
Correct. Yes. I think
Yeah.
that's
And
going
then,
that goes without saying. Yes.
yeah,
Can't be.
managing the expectations and lifestyle.
Mm, mm, yeah. And yeah, I guess now you being an airport physician and doing all that, what sort of presentations do you usually get being in the airport?
Mm,
Do you get everything?
anything,
Anything? Yeah.
everything,
Yeah.
anything.
Yeah.
I mean, in my 4.5 years here, I mean, I've done from the basic garden variety
Yeah.
GP cases,
Yeah.
your cough and colds, your
Yeah.
sprains and aches,
Mm.
your headaches and migraines,
Yes.
your
Yes.
insomnia, anxiety. So
Yeah.
that's one end of the spectrum.
Yes.
The other than, and then the spectrum can go anywhere from gunshot wound,
Oh,
attempted
really?
suicide, gunshot
Wow.
wound, attempted suicide,
Yeah.
uh, severe allergic reaction that you need to secure the airway.
Mm, mm, mm.
Yep.
So being an airport physician, what's any health tips you can offer?
Health tips to offer. I mean, since we work in shift, the
Yeah.
only thing I would say is just have to prepare yourself before you come into the shift.
Yeah. I mean for
In a sense
patients,
that, you know, our patients,
for people. Any tips for
for
flying?
people,
Do you have
okay,
any expert advice?
always come 3 hours before, like they state.
Why is that?
Always, anything can happen from
Oh
like
yeah.
from the bus breaking down to the train breaking down to the counters
Yeah.
being crashed because of a security update,
Yeah.
counters being closed because of a threat. Yep,
So if you know
anything can
if
happen.
I yeah, yeah. Absolutely. I think definitely come on
Yeah,
time. Don't be late. So it
yeah,
takes the added stress out. But
yeah.
if I'm around the airport, will
No
you let
alcohol.
someone in? No alcohol. No alcohol. Will
No
you let
alcohol.
someone, if you have a friend, stuck in check-in with a long waiting queue, do you think you can help and bring us in?
Nah.
All right. All
Unfortunately
right.
not, because
Yeah.
the privileges don't extend that way.
Yeah. I wish. Oh gosh. Anyway, um, now, just in our last final question, Sentel. Like I said, it's been really insightful what you've said. Now, with how technology is going, and you've got AI, artificial intelligence. What's 5 to 10 years? I mean, nobody can predict the future, but I mean, what are your thoughts? Like, how do you sort of see society? How do you see healthcare, the industry? What do you sort of kind of foresee, and how you're going to try and um, you know, how you're going to try and prepare for that.
I mean, you can only future proof AI as much as you can
Hmm.
in terms of the job industry. Harvard Business Review, there was one article, I can't remember, that was released about 2 or 3 years ago,
Hmm.
that said that our children's generation, when they enter the workforce, they will enter the workforce at a younger age than us.
Hmm.
We entered at the age of 23 or 24.
Yeah.
There's a possibility that they will enter the workforce at the age of 19 or 20.
Hmm.
Most of them might just complete formal education to college level, not to university level. And almost 75%, 60 or 70% of the job that they will do has not been created yet.
Hmm. So you don't you
Because
think
that's how
AI is
fast. Yeah.
don't you think AI is going to take some of those jobs away?
Okay, with regards to AI taking over job, this is a very big hot topic.
Yeah.
Hot topic issue, hot button issue as they like to call it.
Yeah.
I mean, after spending the past 2 years trying to understand what AI really is and the layers of AI from simple algorithms to machine learning to deep learning to, neural networks and all that. Right now, we are at the stage where AI is helping us with tasks in a job, not the entire job per se. I mean,
Yeah.
I give you an example, like chatbots,
Yeah.
correct? I mean, simple generic example, chatbots, like whether it's customer service or, the bank or car service or whatever, the chatbots have become a norm. So people say chatbots are so, it's AI and they're not interacting with it so much. But what it's doing is it's streamlining a process. People look at it as, oh, AI is taking away the job. No, it's streamlining the process. The best combination of AI and human is AI does a task that augments the human's capabilities. So using a chatbot as an example, it's streamlining and filtering the request that comes in through the chatbot, whatever that can be taken care of systemly through the system, is taken care of through the system.
Hmm.
Eventually, as you work down the workflow, the logic part that the AI has been trained, it will eventually come to the human. So when the human comes in, they will have almost 80 to 90% of the information that they need to actually address the consumer's concern.
Hmm.
So it can be very fast and efficient that it can address that query. So it
Yeah.
helps to streamline it. It processes all these mundane requests and data.
Yeah.
And then the human comes in when you need that human thinking, that human unsupervised, untrained thinking
Hmm.
to solve the
Yeah.
question.
Yeah. Yeah. I think, yeah, I think from our previous discussions, you've always used AI to kind of help you in your workflows and your work
Yes.
processes, isn't it? Yeah. I mean,
Yeah.
there's always a good
So
side and always a bad side to it.
there's a bad side. End of
Yeah.
the day, with any technology,
Yeah.
there will always be that debate. Yeah.
Yeah, absolutely. All right. Now, Sentil, was there anything else that you wanted to say which I may have forgotten to ask or that you
Mm,
wanted to talk about?
no, man.
No?
I can go on for
Yeah.
hours.
Yeah. Yes, no.
I mean,
I
to
think
talk
I
to you, I
think
can go on for hours.
no, I think this is probably enough. I think the listeners, we gotta, yeah, have mercy on them. Anyway,
Mm,
Senthil, no, it's been great chatting with you. It's a great conversation, and maybe in the future we'll think of another topic and we'll talk about something else. But we'll see how we go for now.
yeah.
All
Thanks, man.
right,
Thanks for having me on your podcast.
all right. Thanks, Senthil, and I'll see you soon.
Oh, you too.
Okay,
Okay,
thank you.
man. Take it easy. All right.
Thank you for staying and listening till the end. I hope you've enjoyed this episode. If this is something of interest or someone may benefit from this, please share, follow, and subscribe. And I'll hope to see you in the next episode. Thank you.